standing hip flexion PAILS plus lift off, okay? So you're gonna need some kind of elevated surface that's hard and something that won't fall over or something that you won't fall through, like a sofa. So you don't want something soft, okay? You also want to hold on to something if you find that balance is an issue, okay? You can also do this with an ankle weight around your ankle, okay? So a few things to keep in mind. You want to keep your hips tucked a little bit, and you want to hold on to this the whole time. Okay, so it's going to look like this. Don't do it yet, just watch. Tuck hips, knee is past the toe, just a little. Okay, if you can. If that is not a range that you have and your heel comes up, then you want to back off a little bit, and this is where you want to be. Find your edges, live in your edges. Okay, both toes face forward. Tuck hips. Then you're going to push down into the box with this leg. This one, it's going to be pushed down. You're going to imagine this is a cardboard box that you need to smush with your own body weight. That's what you're going to do. At the end of the 10 seconds of pushing down at an effort that I will explain, you're going to lift this leg up towards your chest as high as it'll go without taking the other leg along with you. This is strictly about hip flexion of this leg. Okay? So, tuck hips. Knee past toes, push down, 10, 9, 8, 7, 6, 60% effort, 5, 4, 70% effort, 3, 2, 80% effort, 1, lift, knee up towards the chest, hold, 9, 8, 7, 6, 5, 4, 3, 2, 1. Down. Okay? Other side. Tuck hips. Push. 10, 9, 60% effort, 8, 7, 6, 70, 80%, 5, 4, 80%, 90%, 2, 1, lift. Hip flexion, I have more on the right side. 6, 5, 4, 3, 2, 1. Okay, of course, your hip flexors are going to feel tight. That is normal, okay? You're going to feel them a little bit more because we brought attention to them. We're working them. We're shortening them. We're allowing them to be used in their shortened end range, which is a position that most people have. Not a position. It's a range that most people cannot control because we sit all the time with our hip flexors shortened but not used. So they feel tight, but they're not tight, they're generally weak. And I hate to use the word weak, but that's the best way that I can put it, okay? They originate on your spine, your lumbar spine and your iliacus, so this like big bone in your hip, and they insert onto the inner aspect of your femur, right? This long bone in your thigh. So they're super important. They're like the antagonist of the glutes, right? They do the opposite of the glutes, right? Glutes do hip extension, hip flexors do hip flexion, aptly named. Okay, and that's it.